My name is Kelly Papish. I am a nurse practitioner and clinical director at PMD Alliance. And if you've been to our programs before, you know PMD Alliance is really dedicated to getting resources and education to our community. And so today we're really excited to talk about this topic, which is near and dear to my heart. It's what is an APP and understanding what that role is on a multidisciplinary team within the movement field. And so I have two special guests with me today, Meredith Hatcher, who is a PA, and Erin Zinn, nurse practitioner. And I don't know if you want to put in your chat or just show a show of hands, but we'd love to see how many of you out there are familiar with the term APP. And if you are, will you put that in the chat for us? I just want to get an idea of what your experience. Have you had experience with an APP? Also, have you ever seen an APP in clinic? And the term APP, I'm going to give you a hint if you don't know, it's Advanced Practice Provider. And that term encompasses nurse practitioner and PA, or physician assistant, physician associate. So now if you've seen an APP or familiar with them, please put that in the chat. So to walk us through some of this, we want to kind of go over with you what is an APP and a nurse practitioner or PA. What are the roles within a healthcare team? Why is it important for you to know that? And what can we do on a healthcare team? So on a multidisciplinary team, what can an NP or a PA offer to you as a person living with a movement disorder or a care partner? And so Meredith, being a PA, could you explain to us what is the profession? What is a PA?
Yes, I'm happy to. And it sounds like a bunch of y'all are familiar with NP and PA. So that's wonderful. APP is just kind of encompassing both of us together. Physician assistant or physician associate, we are licensed clinicians that on a daily basis, we see patients, we treat conditions, we can prescribe medications, we can order labs, imaging, all that good stuff. We are working generally under the supervision of a physician. And I think that can be a little bit misleading sometimes. That doesn't necessarily mean we are in the same building as the physician or working very closely with the physician on that particular patient. We are often working independently still, but as a team. I think that one of the biggest things that you'll hear us talking about as APPs is that we work as a team. So while we may be seeing a patient individually and ordering medications or tests on our own, we do communicate often with one another, and same with the physicians. Will often chat with us and we'll discuss cases. So I think that's important to clarify. And you'll hear physician assistant and physician associate, as the assistant term has gotten to be kind of confusing, as we aren't necessarily just a physician's assistant. We do see patients on our own. So we're more of an extension of our physician colleagues. And you'll see here listed our education. We have our bachelor's degree and master's degree. The PA programs typically take about 2 to 3 years to get that master's degree. And then we have to pass our national board exam. And then we're required to continue education every couple years. So that is kind of our PA in a nutshell.
And Meredith, will you give us a kind of an overview of your experience getting to become a PA, and where are you working now, and how many years experience do you have?
Yes, of course. I kind of stumbled onto it, actually. I knew I enjoyed medicine, but had a friend that was going to PA school right before me. So I stumbled into it, but love what I do. It gives such great flexibility, and that I can focus more on the patient care. I have a lot more time for that aspect instead of the business side of things. And I'm able to have a little more flexibility in terms of the specialties that we choose, or even family life balance. So it's a great option. And generally, A day consists of a clinic seeing patients, but we also do things like research, and we'll also speak outside at programs like this or to support groups, or we'll work with pharma. So there are several different opportunities outside of that. I have been working at Texas Movement Disorder Specialist for about almost 7 years now, and I've only worked in movement disorders. But one thing that is nice about being a PA is you can change specialties if you'd like. And we work in a variety of office settings, but also surgery, emergency room, in the lab. There's a variety of different options available as a PA.
Yeah, excellent. It's wonderful. And I'm excited to kind of dig into some of those in just a little bit. And so, Erin, I'm going to move to you. And if you could just give us an overview of what is an NP, a nurse practitioner, and then we'd love to hear your journey into becoming an NP.
Okay. Yeah, I'd be happy to. So a nurse practitioner is a registered nurse that has gone on for advanced training beyond their bachelor's degree in a master's or doctoral degree program, nurse practitioner program. After you complete that, you sit for your national certification exam, and you need that in order to apply for a license in your state. Nurse practitioners can diagnose health conditions, order and interpret labs, and imaging, as well as, treat medical disorders and offer various treatments. What sets us apart, I think, as nurse practitioners is that we're true to our nursing roots, right? We take a holistic approach, as do the PAs. But we really have time to kind of dig into, people's conditions and issues that they're having and come up with a solution that is beyond just, well, let's change this medication. And then as far as my journey to becoming a nurse practitioner, I was a trauma surgical ICU nurse and realized that I love nursing, but that I wanted more. I wanted to, understand things at a deeper level. And so I went to nurse practitioner school and became an adult nurse practitioner. And while I was in my training, I did some training in neurology and fell in love with it. So I've been a nurse practitioner since about 2008 and started out in general neurology, and then about 10 years ago switched to movement disorders specifically.
Excellent. Thank you.
Mhm.
Yeah, it is pretty similar that there are, what you guys describe and kind of how you got into where you are, maybe by chance or by interest. But now you're both working exclusively in movement disorders. And you mentioned this a little bit, Erin, but can you guys describe maybe the biggest difference from what I'm hearing? It may be the medical versus nursing model. Does that ring true with you guys? How do you describe that to people when they ask you?
Mm-hmm. I think generally a PA nurse practitioner, our roles are very similar in the clinic. So
Yeah.
there's a lot of similarities between what we do, but you'll see some of the differences listed here. And probably the bigger one is just that our schooling as a PA, we follow a medical model similar to physicians. When PAs, when the career was first established, it was actually from, I believe, an Army medic, and they kind of took that. They already had a lot of medical experiences. A lot of us do, nurses do obviously as well. I was an EMT before school, and a lot of people start out in something like that and then go on. So it follows a medical model, whereas nurse practitioners follow more of that nursing model, and often have a lot of experience as a nurse ahead of time. Do you have anything to add to that, Erin?
Yeah, I mean, I think you explained that very well. We do follow more of a nursing model, and maybe that's like the holistic kind of approach that we take, like seeing the whole patient. And I think as far as how we work with our physician associates you know, some NPs, depending on the state they work in, can work independently. Other states are like a collaborative agreement with a physician, which it seems kind of like semantics really when it comes down to it. But it's just kind of one's under the board of nursing and one's under the medical board. So.
Yeah, and
Yeah.
I know there's a lot of initiatives, for both the NP and PA profession right now to get a compact licensure, which means that if you are licensed in one state, perhaps you're licensed in another state. There's also different initiatives for full independent practice for both NPs and PAs that are being, I guess, advocated for at this time as well, which may change a little bit of the scope for an NP or a PA. And so when we look at the minor difference that we might see, I tend to see more PAs go into perhaps, as they're trained, they're trained as in general, like within the medical model, they go into a lot of different specialties or general areas. And so they get a broad introduction, where an NP may focus on pediatrics, adult, family, so their scope may be more limited when they're at that advanced degree level. That being said, when it comes to movement disorders, is the role different or is it similar? And what does your role look like, on a healthcare team?
It's very similar. And I think you touched on something important, just that those of us here, we work only in movement disorders. And I think that sometimes is a misperception that because we're a PA or nurse practitioner and we're trained generally, that we may not be as specialized, but because this is all we do all day, every day, I live and breathe Parkinson's. So it's often something we're very passionate about, and we do have a lot of experience in. So we again work collaboratively. Many of us work with NPs or with nurses or with our physicians. So we are just one part of your care team.
Yeah, I would agree with that. I kind of almost liken it to like an MD versus DO kind of. It's like the approach or how you got to that role. You're really serving a very similar role and the goal is the same, right? Patient care to the best of our ability at expert level. But the roads that got us to that point were just a little different. But as far as the team that I work with, the PAs and the NPs are we do the same job.
Yeah, that's been my experience as well.
Mm-hmm.
In clinic setting, is that they're interchangeable, NP or PA within the movement team. But you see here like the impact on patient care, and this goes without saying, we'll talk about it more on the movement team and why it's so important, but it's improving access to care and enhancing patient outcomes because there may be more time for patients. I heard time that we're given, and we do provide high quality care. And I think that's some of the things that we want to touch on as we go through this. And so can you give me any examples that you may have personally experienced or that exist within the field of APPs for perhaps challenges or maybe opportunities? Erin, do you want to start with that?
So, I think one of the kind of surface challenges is just this, trying to explain what our role is on a team and really demonstrate that to patients. I think, that added layer that you get as having an APP on your team, that without you would not, have that added support or holistic approach.
Mm-hmm.
And the time, I think, we are extremely lucky as APPs to be, awarded extra time with our patients, which is very important to allow them to really kind of dig into what's going on. Because, a tremor, you may say, yeah, well, my tremor's bad. Well, in kind of discovering, well, when does that happen and why does that happen? You know, maybe you uncover more like it's an anxiety driven thing as opposed to a progression of your Parkinson's and you're going through a difficult time. And so we need to address some of the underlying causes of what the issue that you come in with, um, you know, to really treat you to the best of our ability.
Mhm. I think the time is a big thing, and a lot of us where we really focus our attention and where we maybe shine is the education aspect, that
Yeah.
because we have that extra time, we do have the time to really dig into what does it mean to have wearing off, and what are the differences between these medications, and maybe what is deep brain stimulation, whereas a physician, maybe they have often they get to know you as well, and they spend some time, but you may only see them once a year, whereas I may see my patients more often. So I generally get to know them and know what are the things that are the most important to you with your Parkinson's. And we can really dig in, and over time, we can really educate a lot more. And I think something that is a challenge that we often run into is just like you said, Erin, the fact that we're even having this to begin with, that we're often having to explain what is an APP, whereas everyone knows what a physician and a doctor is, right? And they come automatically with that level of trust. If someone doesn't know what my background is or what my education is, that trust is not necessarily there from the beginning, and it's something that we have to earn. And so I think sometimes that can be a bit of a challenge when going into a visit. We don't necessarily have that up front. So that is something that it is getting better now that more people know what an NP or a PA is. But that is something that I often will run into, is I'm having to explain how long I've been working in movement disorders, or why we are passionate about it. And so I think that's something that is why we're putting this on, so that that can be understood, and we can continue to really serve our patients as best we possibly can.
Yeah, I agree with you guys, and I echo what you've said. It's one of our biggest challenges is just explaining what we do. And so we're hoping to continue to spread awareness. So for everyone on today, that's what we're trying to do. We hope that you get that from this. And let's talk a little bit more about the movement side of things. So let's go into some neurology talks about this. The American Academy of Neurology has a position statement saying that APPs are crucial to providing quality care, improving access, and they're the best utilized on a multidisciplinary team. And so having the support from the AAN really is, just helps us, when we're talking to our teams or to our patients or to our community about why we are added onto that team. In fact, you may have heard of Centers of Excellence put out by the Parkinson Foundation, and the Centers of Excellence require many different components to a multidisciplinary team, including advanced practice providers. It's not replacement for a physician, it's the addition of the APP on the team that enhances the care. And so this is, you might have seen something like this before, but just showing the patient and care partner and families in the middle and everybody else that is really helping take care of this community. Every single person is important in that, and including the neurology APP.
Mhm.
And so if you could, I would love to hear from you guys. Meredith, I know we have some questions already. I saw some that said like, what can you do? What can't you do? What can you tell us, like, what does your week look like? So what are the things that you do in a given week? And I know there's many, but just give us an overview of the things that you can do and what you're allowed to do within your scope.
Mhm. Most often I am seeing patients and visits, and that can be most often follow-up visits. So as I mentioned, I'm often getting to know patients over years. We're seeing each other every couple months, mainly follow-up visits, and that can include deep brain stimulation. That can include botulinum injections. we help manage pumps like Duopa, or intrathecal baclofen is a muscle relaxant pump. So I do a variety of things within those follow-up visits. Occasionally, I will see new consults as well, although usually in our clinic at least, my physician colleague sees most of the new patients. Um, and so that's kind of the chunk of what I do. Is most of the time is with patients, but I mentioned briefly I do also have the opportunity to do some research, and then I often will work with some of the pharmaceutical companies just to help kind of give advice to what we do on a daily basis and where patients have the most need. And then the other thing I love doing is speaking to support groups and doing things like this, where I get to see people outside of office visits as well.
Excellent. And Erin, how about you? Can you tell us like what a typical day or maybe a typical week might look like? What are the different roles that you have?
Yeah, so like right along with what Meredith said, I see follow-up patients that, I follow over years. I do deep brain stimulation, I do medical management. Another piece of what I do is I run our newly diagnosed Parkinson's disease shared medical appointment. So it's really an opportunity. It's like several hours. We do a lot of education. We do a lot of you know, discussion between patients about what they're experiencing, like how they have treated it, what they're finding, which is great because, our patients then are able to kind of take pieces of what others experience and maybe apply it to their life. And so I love doing that piece of it and just getting that education out there so that we really inspire our patients to take control of their disease process and be in the driver's seat of treating it.
Yeah, it's amazing. You both mentioned you do deep brain stimulation programming. That's like initial programming and follow-up programming. Is that
Yes.
correct?
Yeah, that's
Mhm.
correct.
Do you guys know offhand how long the wait is to see the physician in your clinic right now?
Yes, for us, for a new patient, it's about 6 months, and his follow-up wait time is about 4 months.
And how about to see you, Meredith?
Mine is around 1 to 2 months, but generally we have a little bit of flexibility with that too.
And Erin, do you have any idea of how long it might take to see some of the physicians in your clinic?
So I think it's probably around the 6 month, both for follow-up and for new patients. For me, it's about 3 months. But again, I agree, Meredith, that you can kind of finagle some things if you need to get somebody in sooner than that, if there's, an emergent situation going on.
Yeah, and do you both do telehealth medicine? And does that
Yeah.
offer more access?
Absolutely, especially here in Texas with how it's obviously a lot of travel room, so that's a big help.
Yeah.
Yeah. And
I
even
mean,
some PBS programming you can do virtually as well, which is great. Um,
that's incredible. And I think it's amazing to see that statistic, to see a physician, it's this long. And if you don't know that an advanced practice provider has the right training, maybe you don't think about asking to see that person in clinic and you're waiting, 4 or 6 months when you could get in a lot sooner. And so I want to talk a little bit more about why it matters that there's APPs in movement. You may know this statistic. It's a new data that came out recently within the last year is that 90,000 people are diagnosed annually with Parkinson's disease just in the United States alone. That number is probably low. In any given year, there are about 40 new movement disorder specialists that go newly into practice. And there is about a 15 to 20% vacancy in movement disorder fellowships every year. So the wait time here is even low. This says waiting over 3 months, but you're both saying 4 to 6 months. And Parkinson's disease is expected to double in the next 30 years. So really, if you're looking at this, it's really a public health crisis, in my opinion, that we don't have enough people who are competently or expertly trained to manage patients or people living with Parkinson's disease and other movement disorders. And that's where APPs come in, and they can really help enhance care, provide quality care, help with medical management, and get people in sooner and get people better access to care. So one thing I hear a lot, I want to talk about this a little bit. So when you guys have gone into clinics, have you ever had a challenge of, oh, you're the PA, when do I get to see the doctor? Or you're the nurse, when do I get to see the doctor? And can you kind of tell me what you say in those situations, or how do we navigate that? Because I feel like there are people maybe even listening today who would rather see a physician than an APP. But I want to let our community understand that we can provide care, whether it's in the interim, in adjunction, in addition to, or in place of at times.
Mhm. Yeah, I do run into this fairly often, and it's usually a lot of times it's people that have not met me yet, or or they aren't familiar, haven't seen a PA or nurse practitioner before. So generally, once I meet them and they understand that this is all I do every day, and I am very comfortable with Parkinson's, they are more comfortable seeing the physician. But often what I will say is that we work very closely as a team. We're in the same office space. If there is ever something that we need to chat through, we will. And like I said, he will often come to me and we'll talk through cases together, because a lot of the patients I have seen more frequently, and I may know them a little bit better. And so it is something very much so we work as a team, and we do regularly go to neurology conferences. We continue our education so that we can be the best clinicians that we can for our patients. We work very hard at that. So I often just emphasize that again, we work as a team, and that we are educated and specialized in movement disorders.
Yeah, Erin, do you have anything to add? Like, why is it important for the community to recognize what an APP can do in a movement disorder clinic?
Yeah, so I think, as far as when people are a little reluctant, or like, okay, who are you? I thought I was seeing my doctor. Um, or they request to see their doctor, I do the same thing, Meredith. I just explain, my training, and that we are just an additional layer to the physicians. We're not trying to take the physician's place, or, take over the care, but we're an additional benefit that kind of comes along with being part of this multidisciplinary team. And I think once people experience the time, the education, the holistic approach, the just really getting to know you on a deeper level, they appreciate that. And then I don't really have issues as far as, I don't want to see you, and I tell them, if I have a question, you bet I'm going to go talk to the physician colleagues, or maybe my APP colleagues as well, about how best to handle this. And the physicians do the same, like Meredith said. So I agree 100%. Yeah, it's a great, I have been so lucky to work with great APPs as well as physician colleagues that really support our role, and understand the benefit of our role on the team.
Mm-hmm. Yeah, I think that matters a lot, is feeling supported and invested in. Do you have anything that you would like to add about like misconceptions or what APPs are not, whether it's from a community, caregiver, patient, someone living with a Parkinson's, or a peer point of view?
Yeah, I think I mentioned early on that our name can be a little bit misleading, the physician assistant piece. That there is a reason why a lot of people are changing it more to physician associate, because we are just more of an extension of our physician colleagues rather than just their assistant. So that's one thing. And I think another misconception that I get a lot is that we are maybe just the nurse, and then the physician will be in after us, rather than you're seeing us independently. Um, Many of us maybe started as nurses, or like I did as an EMT. And so not that our nurses are amazing aspects to our team as well, not to downplay that, but more just that that we go a little beyond that, and we're able to practice independently and provide that care. So an example I have is just last week, I had a patient that had not met me yet, and they were upset that they weren't seeing the physician, and just said something like, well, is Meredith just going to come in and check my vitals? That was kind of their assumption, that that was all I was able to do, was check their vital signs. And so after I went in and talked with them, and spent quite a bit of time with them, they were very happy. So it worked out fine. But that's a good example of a misconception where people just don't understand our training and our purpose.
Yeah, I think it's interesting too when you say, okay, great, I saw you, but now is the physician going to come in? Am I going to see the doctor? What is it like in your clinics? Like, do you see it once you take a patient after diagnosis? Are you with them for the rest of their journey? Are you alternating visits with the physician? How does that work? Is it based on availability? Can you speak to that?
Yeah, I mean, I think it varies a little bit patient to patient typically. So, if I see a patient, then they would be my patient from an APP standpoint, and the physician's patient, just like you don't switch between physicians, we don't typically switch between APPs unless it's, a situation where they can't get in to see me for some reason. Um, Meredith,
Yeah. I would agree. We generally, once we see them, there is one other PA in our clinic. They will generally stick with me. However, our physician still likes to see everyone once a year, or every other year. So he will often jump in and see them as well. But what we have found is sometimes that can be a little bit tough, because I am usually the one seeing them, and I may know their condition, or what bothers them most. I may know those little things about them better. And so he does still see them often, but most of the time, once I get to know someone, I will be with them through their journey.
Yeah, it seems
Yeah,
like,
oh,
go ahead.
sorry. I was
No,
just
please
going
go
to say,
ahead.
like, I typically look back and see, okay, well, when was the last time you saw your physician? And if it's been a while, or I have any concerns, then I always say, okay, next visit, I want you to see your physician.
Yeah. And I think it probably varies. There's some people that I've worked with that are like, nope, I don't want to. They're not going to tell me anything different,
Right.
or I get more time with you. There's others that welcome that every year or every other visit.
Mhm.
Yeah, I think that's interesting though, to see how every system is set up, and some are very different. Um, I I I hear this a lot, and I want to talk a little bit about this organization that was developed just for this purpose, to bring awareness to APPs. And part of what we hear often, and maybe you don't, but I bet you do too, Erin and Meredith, is I love APPs. We have them on our team, but they don't stay. I think one of you mentioned early on, Meredith, you might have, that we are, it's a wonderful field to become a nurse practitioner or a PA, because we have the flexibility to change from dermatology to cardiology to neurology, to aesthetics, to whatever it might be. And so we hear that sometimes, and I think that can be a concern for patients, for our community, and for the team members that we work with. What if they don't stay and we're investing all this time in them? My rebuttal to that is that we as APPs need to feel invested in. And once we do, it's pretty hard to leave an awesome specialty like movement. I mean, it really is, because it grabs you, right? This is an amazing community. There's so much hope within the field. There's so many amazing therapies and treatments, and it's fun to be able to implement those and see change. And so, can you tell me, like, how are you investing yourself in the field, and do you feel supported by the people you work around?
Absolutely. That's such a good point. I think it's movement disorder, and neurology in general is such an amazing area, and there's so much growth. And I love that we get to know our patients over time, and we grow close with them. So I personally invest in local support groups and working with pharmaceutical companies to help improve access and give feedback on things. It's been so neat to see the progression of technology and medications, specifically in Parkinson's, but all of movement disorders. Um, I also have been involved in, and some of Kelly will talk about it, but AMDAPP, some of the different resources that are becoming available more and more for PAs and nurse practitioners to continue growing in movement. So I agree with Kelly that once you fall in love with movement disorders, it's hard to leave. But I think where we see people leave the most is that lack of support, and that may be from other people on the team. It can, when you are first going into movement disorders, it can be a big jump sometimes from other things. And if that PA or nurse practitioner is not invested in, it can be really tough to get settled. So that's just like a nurse or a physician, if they are at a new place or a new specialty, they need to be invested in. But sometimes for an APP, it can be tough to find that support.
Yeah, thank you. Yeah, I would love to talk a little bit about this. And we talk here on this page, you can see this logo AMDAPP, but we just want to introduce that to any of you who may not be familiar. It is the Association of Movement Disorder Advanced Practice Providers. And while I'm the clinical director at PMD Alliance, I'm also the executive director of AMDAPP. And this was created out of the need for exactly what we're talking about today. We, about 4 or 5 years ago, had a group together. And Meredith and Aaron have been involved for a long time, but just, really bringing together our peers from across the country. We were able to find NPs and PAs who work in movement disorders, and we brought together a group. And we said that we need to make something bigger with this. We need to be able to find resources for one another and support and mentorship. And so we created AMDAPP, and we have just under 150 members, growing strong. We are under a year old. And our goal with this is to provide professional development to advanced practice providers who work specifically in movement disorders. And I just want the community to know as well that it is something that we see the awareness is a huge uptick. I think that there is a lot more eyes on our field, which is really good for all of us, because what it does is it enhances the education that we can get, the access that we can get to peer support, and ultimately provide better care for our community at large. AMDAPP is working on 2 major initiatives. One of those is a certification. And so we're working with a professional testing company out of New York to develop a certification for APPs who work in movement, which instead of, coming back with, oh, you're just the nurse, when will I see the doctor? We can say, well, we actually have passed a, pretty strong exam based with competency to show that we can demonstrate that we can competently care for someone with Parkinson's and movement disorders. And that's what our focus is with that. The other thing we have is mentors and onboarding toolkits so that we can really get somebody up and running into a movement clinic so that they are feeling supported the entire way. And we're hoping what that does is it makes a bigger impact on our community at large. I just wanted to say that something that we notice is we have APPs who work in Wyoming or Montana, and I keep thinking about these 2 APPs specifically, and they don't have a movement disorder specialist within a 100-mile radius. But what a gift it will be to that community when there's a certified APP who can provide management to them competently, and that the community can identify that. And so we're really excited to be able to offer this association to advanced practice providers who are, across the country. But but also to our peers so that we have the professional development, the support, and the peer connection. The networking has been wonderful. I see people on this call, and again, Meredith and Erin and I have gotten to know each other like we're all close friends because of this. So it's become very, very important in what we do in our daily practice. And so, Erin, Meredith, do either of you have anything that you would like to add as far as like what you want people to leave here knowing, especially about an APP, or anything that you'd like to just leave the group with before we go to some questions?
Yeah, I think the main thing I think to take away is we are here for you. Our goal is patient care and improving access to good care. And we work hard for our patients. We love our patients. And our goal is not to take the place of the physician. And in fact, I want to work with them. I want to work on their team. So that's not the goal. It's more just to extend access to them, and we can do that. So that's the big takeaway, I think, is just knowing that everything we do as APPs is for you at the end of the day.
Yeah, I would agree with that 100%. I don't think I can even say it better than that, Meredith.
It was a great, yes, and that's true.
Yeah.
We are here for you, and we are all in this field because it matters to us, right? It's become very special to be part of the journey of someone living with a movement disorder. So I want to go into some of these questions. If you have any questions, please put them in the chat. I'm going to send this one over to you, Meredith. Do PAs perform surgery?
So generally PAs are the first assist in the surgery. They're not the surgeon. They're not the one taking the main lead, but they are often the ones that are right there in the action and helping out. And often they're the ones closing up, doing the sutures, and they often can help kind of be the lead on everything until the surgeon actually comes into the room and starts the surgery. So they're very involved, and a lot of times they're very involved after the fact too, in post-op and in the clinic.
Okay, great, thank you. Somebody mentioned that does it cost the same if I saw a doctor or physician versus an NP or PA?
So APPs get reimbursed about 85% of what our physician colleagues get reimbursed from insurance companies. So how that translates to how you are billed would be that it's a lower reimbursement.
Yeah, I think it also it can depend on the type of billing. We do something called incident to billing in our clinic that states if our physician is in the office with us, we can get that 15% since we are working as a team. So I think it depends on the state and maybe on the billing practices by each individual clinic. So generally, yes, it's 85%, and unless we do that incident to billing if they are physically in the office space with us.
And somebody said, I found it difficult to find a central registry of local PAs who specialize in PD care. Is there an effort underway to post this? Absolutely. In fact, AMDAPP is really here to make some waves. And that's my entire goal, is to make some waves in the movement community. I think we hope we are, but we are trying to make noise and say, hey, we're here. Especially when we become certified, it might even be easier to identify throughout the country. But we do have a heat map internally that we do plan to put onto our website. We've talked to some larger organizations like the Movement Disorder Society and others who are interested in having that same registry. So there are efforts to be determined, or like the timeline is, to be determined, but please keep checking. That will be something that we are prioritizing. Erin, can NP or PA insert IVs, and what else can they do?
Yes, so NPs and PAs can insert IVs. Registered nurses can insert IVs as well. We do DBS programming, some baclofen pumps management, Botox injections for dystonia. or maybe excessive saliva, so sialorrhea. So those are some of the procedures that we do, yes.
Mhm.
This is an interesting question, and you may both have a different answer to this. But some of the doctors I know insist on using their last names, like Dr. Smith, yet the NPs and PAs use their first name. Are you comfortable with this? Do you think you'd get more respect if you used your last name?
I prefer my first name, and I think that's just because I prefer the familiarity with patients and that type of relationship. Um, I always think it sounds funny when people call me Miss Hatcher, so I prefer using my first name. But in terms of the respect, I don't know. I don't know that it's a name or a title. It should be more based on our experience and how we treat you as patients. Um, we worked hard for our degrees. It's not necessarily, to me, it's not as based on the title, but more as I'll earn your respect and I'll earn that based on your care management. That's my personal opinion. I know there are some people out there that also, especially nurse practitioners, that got their doctorate, and so they do go by doctor, but most PAs don't have their doctorates. We have our bachelor and master's degree.
Yeah, I agree, Meredith. I think I prefer first name as opposed to Mrs. Zinn. Because yeah, I see my patients almost like I see my family, right? So I wouldn't expect my family to say Mrs. Zinn. I would expect that familiarity. And we spend a lot of time with our patients and we get to know them very well. So it would feel almost awkward for me for the formality of using a title as opposed to my first name.
Yeah, I think everybody is different in that. And I agree with you. I do have my doctorate. I've never gone by Dr. Hapish, maybe in an education setting, but in the clinic, I personally feel more comfortable saying I'm Kelly, nurse practitioner. Um, and I know that everybody, should be able to highlight their highest level of achievement in their degree. I think you'll see that it varies, but majority of people like that personal connection and that it feels less personal using your last name. But that is probably an individual thing that you'll find. When we're talking about names, I would love to hear your thought, maybe Erin, on the term mid-level, the mid-level provider. Do you
Yeah.
think it provides mid-level care?
Right. So this is a term that, gosh, has been around for a while that we have really worked to shift away from. I think it was, brought out because people weren't really sure how to define what do APPs, nurse practitioners and physicians assistants do. They can do this, but they don't do this. And when you're being compared with a physician. And so they're kind of the middle of the road, but it's kind of a sticking point for some of the APPs because we don't want to have the term mid-level as in we're not providing expert care or to the top of our license or certification. We provide excellent care. And so, yeah, we have really tried to kind of pivot away from that term. So it's kind of falling out of favor, I would say.
Mm. Yes, I would agree. I tend to just, kindly remind them that we aren't stuck somewhere in the middle between a physician and a nurse. But in fact, I'm working at the top of my license. This is the field we went into for a reason, providing expert care. And so that term is a little bit outdated, I would say.
I think that's kind of like one of the misperceptions too with APPs is that patients and others in the community alike, who don't understand what APPs are. Oh, are you a junior doctor or are you trying to become a doctor? No, I'm not. I enjoy being a provider to patients, using my nursing roots as an advanced practice provider.
Right, but our goal is not to become a doctor.
Correct.
In fact, I chose not to become a doctor.
Yes. Yeah, that was a conscious decision.
Right. I have a question here. So do either of you have advanced training specifically in DBS programming? And what was that like?
Mhm.
Okay.
Absolutely, yes. We
Yeah.
from when I very first started in movement disorders, we had quite advanced training, went to several courses for that. It's also learning firsthand from patients and colleagues, and so there are hours and hours that go into DBS training. It is complicated, especially as technology continues to grow, but you saw, I think, early on in our education, the continuing education hours that are required to maintain our license. A lot of that includes movement-specific education, including DBS.
Yeah, I would agree with that. I would say we had advanced training in DBS programming, and we continue to have advanced training in DBS programming because DBS is, the technology is just booming and we're learning new things all the time. So it's really part of the journey and ongoing training that we need in order to be able to provide the programming piece of movement disorder care.
Yeah. It is a special skill, but I would say that it seems like the majority, if there's an APP at a clinic, they're doing majority of the programming versus the physician, it seems. Somebody wrote, it seems like there are not many movement disorder specialists with Parkinson's increasing so rapidly. What is being done to get more professionals into the field? Yeah, it's alarming. It is a scary statistic. Part of the reason why we knew AMDAPP needed to be formed and to develop this certification is to bring more awareness that there are people who are competent to care for and manage Parkinson's outside of just a movement disorder specialist. There are many things actually being done. With AMDAPP specifically as the certification, we also are going into schools and universities where there's PA and NP students and trying to get them more excited about doing a rotation and movement early, and then setting them up with preceptors that work within the field so that hopefully they'll stay. I won't call them out, but we have an APP on the group tonight who it was part of a fellowship, and the Parkinson Foundation had put out an APP fellowship last year. They had 3 advanced practice providers do a 1-year fellowship, just like a physician would. And it was very successful. All 3 of those APPs stayed in movement and are thriving in the movement space right now. And it just goes to show again that investment matters. Residents and fellows, there are a lot of initiatives by different groups and different stakeholders trying to get more residents and fellows interested in movement. So there are things being done, but yes, our goal is to retain as many people as we can in this field. Somebody mentioned that they saw an NP last year and they were notified that the appointment would have to be rescheduled, and they would have to see the NP but they preferred to see the doctor. They were hesitant at first, but once they saw the NP, they had no regrets. It was wonderful and very thorough and better bedside manner. This person said, I've been going to the same hospital for neurologic care for 7 years and never knew the NP was part of the team or an option. Any comments on that?
I just think that's so common, and that's the point of this talk, that we just want you to know we're here and available. And most of the time, if you call in and you ask for the physician at our clinic, they will say, well, he has an appointment in 6 months, but Meredith has one in a month or 2. And so they will offer that, but it's also something that going in, if you know you are okay with seeing an APP, that you can ask for that up front.
And then the last question that we have in the chat is, do you guys have any involvement or success with REM sleep disorders? Is that something that you manage and treat as well?
Yes, so that is a really common aspect of Parkinson's disease. It's something that we ask most people about, and we involve that in their treatment.
Yeah, great. The non-motor components. I don't know if you are able to put something in the chat, but I would love to hear from you guys if you think a certification for an APP makes a difference in either your opinion of, your awareness of, does that positively impact your your thoughts of what an advanced practice provider might be able to support you with in a movement disorder role. I don't know if that's an easy option for a poll, or if you could put that in the chat. And while you're doing that, yes or no, or maybe, or undecided, please put that in the chat for us. Otherwise, we also would welcome any last questions. You will be able to review this, share it. It will be available online. We hope that you were able to gain something from this today, and we hope that we were able to provide some information that maybe you weren't aware of. If you ever have questions specifically about APP's PMD Alliance and help get you information, as well as AMDAPP, please come and check us out. And, we really appreciate today having Meredith and Erin here today to help share this knowledge. Thank you so much, and your expertise. You guys are wonderful. Thank you to everyone for being here. And if you have anything else to add, please send us a note at PMD Alliance or AMDAPP.
Thank you all for having us. I appreciate the comments. That's great.
Yeah. Thank you all.
Thanks.